Hello, my name is Shawn Jenkins. Several years ago, I lost my brother Brian to suicide. Now, Brian left a rather lengthy audio suicide note, and over the past 10 years, I've been using clips from that recording as the basis of a suicide awareness presentation. I'd like to talk to you a little bit about some warning signs for suicidal ideation. Now, it's important when we talk about warning signs to keep in mind that the list isn't all-inclusive and it's not a checklist. And just because someone exhibits some of the signs doesn't mean that they're necessarily considering suicidal ideation. But it does afford you an opportunity to engage that person in conversation. So I'd say if you're concerned about someone and you feel they may be considering suicidal ideation, engage them in a conversation and ask them some direct questions. Are you thinking about hurting yourself? Are you thinking about killing yourself? Ask those direct questions and be prepared for the initial denial or deflection. But it's a conversation, so circle back to those and address them again. Now, sudden changes in mood and behavior are some of the things that we look for. Watch for hopelessness and depression. Now, depression is the strongest risk factor in suicide. Fortunately, it is also treatable. Some other things to keep in mind are irritability, anger, and anxiety that seem to be out of character for that person. Now, typically when we talk about risk factors, we tend to portray it as someone who has been doing well and then suddenly turns and it starts to exhibit some of the factors that I've just mentioned. That isn't always the case, and sometimes it's actually reversed. You may see someone who's been struggling with issues suddenly return back to what you would consider to be their old normal self. Now, they may have some positive reasons and new approaches that could explain that sudden transition from the struggling aspect back to their positive behavior. But use that as an opportunity to engage and ask them those questions. If they are positive changes, then you can encourage and reinforce those. If, however, the weight of the world has been lifted and those problems are no longer bothering because they've considered suicidal ideation, it's an opportunity for you to engage and intervene in that thought process. Now, some other things that we can watch for are relationship problems. Relationship problems happen to be the most common factor in suicidal ideation. Some other things to watch for: isolation and withdrawal from your social support networks. So as people begin to withdraw from normal activities or folks that they've hung out with before, ask them about that and see what the underlying cause of that is. Some other things: substance abuse, talking about death and suicide, and of course past suicide attempts have to be taken very, very seriously. If someone who's engaged in that before makes any kind of intimation that they're considering that again. Now, this isn't intended to be an all-inclusive list, but what I do want to leave you with is that if something seems out of character and something concerns you, trust your intuition. You're more perceptive than you give yourself credit for. So initiate a conversation. Ask that person those direct questions again. Are you thinking about hurting yourself? Are you thinking about killing yourself? And again, it's a conversation, not just two direct questions. Engage in a conversation with them. I hope this was helpful. Thank you for your time.